It is 4:17 in the morning. The bedroom is dark. You are not exactly awake, and you are not exactly asleep. There is a strange heaviness sitting in the center of your chest, like someone has placed a folded blanket on your sternum. Your jaw feels slightly tight. You feel a little nauseous, the way you might if you ate something too rich the night before. You think about the dinner you had, the spaghetti, the second helping. You roll onto your other side, take a slow breath, and tell yourself it will pass by morning. And in millions of bedrooms around the world tonight, exactly that scene is playing out. And tomorrow morning, a significant percentage of those people will not wake up the same. Because what almost no one understands is that the human heart attack does not arrive out of nowhere. It announces itself, sometimes for hours, sometimes for days. And the announcement comes most frequently in the dark, quiet hours between roughly 4 and 6 in the morning, in a body that is just beginning the most dangerous biological transition of its entire 24-hour day. Tonight, I am going to show you exactly why those 2 hours are the single most dangerous window in your day if you are over 60. What your body is doing in the 24 to 72 hours leading up to a heart attack that you have almost certainly been blaming on something else. The 7 warning signs that 9 out of 10 seniors sleep right through, and the precise sequence of what to do in the first 10 minutes if you ever recognize even one of them. I'm going to tell you about a 68-year-old retired teacher named Robert, whose wife found him on the bathroom floor at 4:22 in the morning, and the 2 days of warning signs he and his wife had quietly explained away. And I'm going to give you a simple bedtime protocol that lowers your overnight cardiac risk starting tonight. Stay with me, because the conversation I am about to have with you is the conversation that does not happen in a 15-minute appointment, and it may be the most important thing you watch this week. I am Dr. Elena Hart, and I have spent decades in the kind of rooms where a son or a daughter is asking me, why did nobody see this coming? And in case after case, the answer is the same. Somebody did see it coming. The person it was happening to. They felt it. They felt it for hours. They felt it for 2 or 3 days. They told themselves they were just tired, that the air conditioning was off, that the eggs disagreed with them, that they had pulled something in the yard. They mentioned it to their spouse, and the spouse said, "You have been working too hard, go to bed early." They thought about calling the doctor, and then thought, "I don't want to be the patient who cried wolf." And the body, which had been sending up flare after flare from a heart that was running out of room, finally collapsed at 4:30 in the morning, in a hallway, in a bathroom, in a bed. If you take one thing from this video, take this. The heart almost always warns you first. The problem is that the warnings do not look like the heart attacks in the movies. They look like indigestion. They look like the flu. They look like a bad night of sleep. And until somebody sits you down and shows you what the real signals actually look like in a real human body over the age of 60, you will keep waving them off the way you have been waving them off for years. If clear, honest health information delivered without theatrics is what you came here for, hit subscribe right now and tap the like button. It is the simplest thing you can do to help this information reach the next person who genuinely needs it. And that next person may be sitting at their kitchen table tomorrow morning, wondering why their chest feels strange. Before I go one paragraph further, I want to draw a hard line for you, because this is the kind of topic where the difference between watching the rest of the video and calling for help right now matters. If at this very moment, while you are sitting and watching this, you are feeling pressure or squeezing pain in the center of your chest that has lasted more than a few minutes, especially if it is spreading into your left arm, your jaw, your neck, your back, or between your shoulder blades, if you are short of breath without having done anything to cause it, if you are breaking out in a cold sweat, if you feel sudden weakness or lightheadedness, if you are unusually nauseous and clammy at the same time, stop the video, dial 911, and chew a regular adult aspirin while you wait, only if you are not allergic and your doctor has not told you otherwise. Do not drive yourself. Do not wait for it to pass. Do not call your son first. Do not call your doctor's office. Call 911. The single biggest reason seniors die of heart attacks is not the heart attack itself. It is the delay between the first real symptom and the first medical intervention. Every minute of that delay matters. For everyone else. For the millions of you whose hearts have been sending quieter signals that you have been brushing off for weeks or months. Keep watching, because what comes next is for you. Here is the strangest and most important fact about the human heart that almost no one outside of cardiology truly understands. Your heart runs on a biological clock that is built into every one of its cells. It does not beat the same way at 3 in the afternoon as it beats at 4 in the morning. Between roughly 4 and 6 in the morning, your body enters what doctors call the early morning surge. Your adrenal glands, sitting on top of your kidneys, begin releasing a powerful wave of cortisol, the same stress hormone that prepares you for the day. That cortisol surge does several things at once. It pushes your blood pressure up by 20 to 30% compared to your overnight low. It tells your heart to beat faster as it gets ready to switch you from sleep mode into waking mode. It makes the platelets in your blood, the tiny cells responsible for clotting, significantly more sticky than they were at midnight. And it causes the small muscles inside your blood vessel walls to tighten slightly, narrowing the channel through which blood is flowing. Now picture all of that happening at once. Higher pressure, faster heartbeat, stickier blood, tighter vessels, all converging in the same 2-hour window. In a younger heart, with flexible vessels and clean arteries, none of that is a problem. The system handles it the way it has handled it every morning of your life. But in a heart that is 60, 70, or 80 years old, with vessels that have stiffened with time, with a small fatty plaque that has been quietly growing on the inside of a coronary artery for the last 25 years, that 2-hour window is when the entire system is under the most stress. And it is the moment when a plaque that has been stable for years can crack. The moment when a clot can form on top of the crack. And the moment when blood flow to a section of the heart muscle can stop. This is why studies consistently show that heart attacks cluster in the early morning hours, with the peak risk falling between 4 and 6 a.m. It is also why so many seniors wake at exactly that hour, with a strange, uneasy feeling in the chest that they cannot explain. The chest is not lying to them. The chest is reporting a real biological event happening at a real biological moment. Let me tell you about Robert. He was 68 when his wife brought him into the emergency room at 4:30 in the morning 2 winters ago. A retired high school history teacher, the kind of man who walked the dog twice a day and never missed a checkup. For about 2 days before the morning that ended in the hospital, something had been off. On Friday afternoon, he had carried a bag of fertilizer from the car to the garden shed, a thing he had done 100 times before. And he had to stop halfway and rest his hands on his knees. He told his wife the weather was making him sluggish. That night, after a normal dinner, he felt a vague burning behind his breastbone, the kind you might get from coffee on an empty stomach. He took an antacid and went to bed. He woke up at 3:14 a.m. with a feeling he could not name, somewhere between anxiety and indigestion. He took another antacid and went back to sleep. Saturday morning, he felt tired in a way he had not felt in years. He told his wife he might be coming down with something. He took a long nap. Saturday night, the burning came back, this time with a faint ache that crept up into his left jaw. He took a third antacid. He told himself it was the spaghetti sauce. At 3:47 on Sunday morning, he woke up with the heaviness in his chest pressing harder than it had pressed any of the previous nights, and a cold sweat soaking the back of his pajamas. He sat up on the edge of the bed and the room tilted. His wife heard him fall in a bathroom at 4:22. He survived because she did not call her son, and she did not call the doctor's office. She called 911. The paramedics had him on a monitor within 9 minutes. By the time the cardiologist threaded the catheter into his right coronary artery that morning, a clot had blocked it almost completely. The 2 days of fatigue, the burning, the jaw ache, the broken sleep, every single one of those was his heart asking for help. His cardiologist sent something to him a week later that I want you to hear word for word. The signs were there. They are always there. The only question is whether anyone is listening. Here is what those signs actually look like in the 24 to 72 hours before a heart attack in someone over 60. And I want you to count how many you have felt in the last week. The first is a deep, unusual fatigue that does not match what you have been doing. Not the tiredness that comes after a long day in the garden. A heavy, dragging fatigue that hits you in the middle of doing something simple. Walking from the couch to the kitchen, carrying a basket of laundry up 6 stairs, putting away the groceries. This is the single most underreported warning sign of an imminent heart attack, and it is especially common in women over 60, who often have heart attacks without ever feeling classic chest pain at all. Studies tracking women who survived heart attacks found that more than 70% of them had this unusual fatigue in the days leading up to the event, and almost none of them connected it to their heart. The second is a new, subtle shortness of breath with activities that did not used to make you breathless. Climbing the same flight of stairs you have climbed for 30 years and finding yourself slightly winded at the top. Walking from the car to the front door and noticing your breath catching in a way that is unfamiliar. The heart and the lungs are partners. When the heart is struggling to pump efficiently, the lungs feel it first, and your breathing becomes the early warning system. The third is a new pattern of indigestion or burning behind the breastbone, especially if it appears in the evening or in the early hours of the morning, especially if antacids are not really helping it, and especially if it has shown up in the last several days when you have not changed your diet. Many heart attacks are misread as severe heartburn because the heart sits directly behind the lower esophagus, and the nerves that carry pain signals from both organs share the same pathway. Your brain cannot always tell them apart. The fourth is discomfort that radiates anywhere other than the chest itself, into the left arm, into the jaw, into the neck, into the upper back between the shoulder blades, into the right shoulder. These are not random spots. They are the dermatomes, the body's nerve map, where heart pain travels when it cannot stay confined to the chest. A new, dull, unexplained ache in any of those areas in someone over 60, especially if it comes and goes over several days, is worth a doctor's evaluation before it becomes worth an ambulance. The fifth is a strange, broken pattern of sleep, often combined with a low-grade sense of dread that you cannot place. You wake at 3 or 4 in the morning with your heart beating slightly faster than it should, an uneasy feeling in the chest, a flicker of anxiety that has no story attached to it. Your body is responding to the same cortisol surge I described earlier, and it is doing so against a heart that is running on a smaller reserve than it had 2 weeks ago. The sixth is breaking out in a cold sweat without any obvious reason. Not the warm sweat of a hot afternoon. The cool, clammy kind that appears on your forehead, the back of your neck, your upper lip, while you are sitting still in an air-conditioned room. The body is responding to internal stress that you cannot consciously feel, and the sweat is the autonomic nervous system telling you something is wrong on the inside. The seventh is nausea or sudden lightheaded dizziness, often combined with one of the other signs. If you have felt 3 or more of these in the last 7 days, this is not a video. This is a phone call to your doctor's office tomorrow morning, and if any one of them suddenly intensifies, this is a call to 911. Now, why does this happen specifically after 60? The honest answer has nothing to do with willpower or bad luck. The arteries that feed your heart are roughly the diameter of a piece of cooked spaghetti. By the time you are 60, those arteries have been carrying blood under pressure for 6 decades, and most of them have small fatty deposits, called plaques, lining their inner walls. In many seniors, those plaques are completely silent. They have been silent for 20 or 30 years. But silent does not mean stable. A plaque becomes dangerous, not when it grows, but when it cracks. And what causes a plaque to crack is the kind of mechanical stress that happens at 4 in the morning, when blood pressure surges, vessels narrow, and the heart rate climbs in preparation for waking. The older the artery, the less able it is to absorb that stress. The aging heart also has a reduced reserve. In your 30 seconds, if a coronary artery narrows by 50%, your heart can compensate without you ever feeling it. In your 70 seconds, the same 50% narrowing leaves you with very little margin. Add to that the medications most seniors are taking, which can mask early warning signals, blood pressure medications that blunt the body's adrenaline response, antacids that flatten the difference between indigestion and angina, sleep aids that take the edge off the 4A.M awareness. And you have a situation where the heart can be in real trouble, and the person it belongs to is not getting the alarm signals clearly enough to act on them. This is not the body failing. It is the body warning quietly into a room where nobody has been taught to listen. And here is where the most common mistakes seniors make become critical. The first mistake by far is blaming. Blaming the indigestion on the meal, blaming the fatigue on the weather, blaming the jaw ache on a dental issue, blaming the back pain on the mattress, blaming the 4A.M waking on stress. Every one of these is a story your mind constructs to keep the world feeling normal. And every one of these is the reason a heart attack catches a senior off guard. The second mistake is waiting. Telling yourself you will see how it feels in the morning. Telling yourself you will mention it at the next checkup in 3 weeks. The window between an early warning sign and a full heart attack can be hours, not weeks. The third mistake, and this one kills people every single day, is driving yourself to the hospital. When a heart attack progresses, the rhythm of the heart can become unstable in a way that causes sudden collapse. And the only place that can save you in those minutes is an ambulance with a defibrillator on board. A car cannot save you. A spouse driving cannot save you. Only paramedics with the right equipment can. The fourth mistake is taking aspirin and going back to bed. Aspirin is the right idea, but only on the way to the hospital, not as a substitute for one. The fifth mistake is being embarrassed. Embarrassed to call an ambulance for what might turn out to be nothing. Embarrassed to wake the family. Embarrassed to be the one who overreacted. Hospitals would rather see you and send you home with a clean heart than see you arrive too late. Nobody at the emergency department will ever judge you for coming in with chest pressure that turned out to be reflux. Every one of them has seen the patient who waited and arrived too late, and they would much rather see you while you can still be saved. Now the most practical part. What do you actually do if you have recognized any of these signs in yourself this week? You have 2 timelines, and the timeline you are on depends on what you are feeling right now. If you are feeling active chest pressure, severe shortness of breath, sweating, or any of the warning combinations I described in the emergency section, you call 911 right now. Not your doctor, not your spouse first. 911. While you are waiting, chew 1 regular aspirin. Sit upright or slightly reclined. Unlock the front door so paramedics can come in without delay. And stay as calm as you can with slow, steady breathing. If you are not currently in active symptoms, but you have recognized 2 or 3 of the warning signs from the last several days, your timeline is the next 24 to 72 hours. Call your doctor's office first thing in the morning and tell them you have had unusual fatigue, shortness of breath, jaw discomfort, or unexplained sweating in the last week, and you want an urgent evaluation. Ask specifically about an electrocardiogram, an ECG, and a blood test called a troponin level, which detects damage to the heart muscle even before a major event. If your doctor cannot see you within a few days, the urgent care or emergency department is a reasonable next step. This is not overreacting. This is the conversation that prevents the morning that nobody wants to live through. There is a bedtime protocol that lowers your overnight cardiac risk, and it is simple enough to begin tonight. The first piece is the timing of your last meal. Heavy, fatty meals eaten within 3 hours of sleep raise the workload on the heart through the night and increase the surge response in the early morning. A lighter dinner finished by 7 or 7:30, especially low in saturated fat, is one of the most underrated cardiac protections available to you. The second is hydration. The blood is at its thickest in the early morning hours, partly because of overnight fluid loss through breathing, and partly because of the natural drop in nighttime water intake. A modest glass of water before bed, and another one as soon as you wake, significantly reduces blood thickness during the dangerous window. Not so much that you are up to the bathroom 3 times, just enough to keep the system moving. The third is the timing of your evening medications. If you take a blood pressure medication once a day, ask your doctor whether taking it in the evening is appropriate for your case. A growing body of research suggests that for some people, evening dosing provides better overnight blood pressure control and lower cardiovascular event rates than morning dosing. This is not a decision to make on your own. It is a question to bring to your physician at your next visit. The fourth is the morning transition itself. Do not leap out of bed at 5 a.m. and dash to the kitchen. Sit on the edge of the bed for 30 seconds. Plant both feet on the floor. Take 3 slow breaths. Stand up gradually. The transition from horizontal sleep to vertical activity is one of the moments the heart works hardest, and giving it a half minute to adjust is one of the simplest gifts you can give it every morning of your life. The fifth is a monthly self-check. Once a month, on a quiet day, take a slow 10-minute walk on flat ground. Is your breath the same as it was 3 months ago? Is your chest the same? Is your pace the same? If anything has shifted in a way that does not match how much you have been moving, that is a conversation for your doctor before it becomes a conversation for an ambulance. There are warning signs you must never ignore, and I want to be very direct about them. New or worsening chest pressure, even mild, even brief, even if it goes away on its own, is not normal in a senior. Get it evaluated. Shortness of breath that has appeared in the last few weeks during activities that did not used to make you breathless is not deconditioning. Get it evaluated. A sudden, unexplained fainting episode at any time is a same-week medical visit. New ankle swelling, especially when combined with shortness of breath or sleeping propped up on more pillows than you used to, is a sign of heart strain that needs to be checked. Heart palpitations that are new, persistent, or come with dizziness need an evaluation. Cold sweats that appear with any of the other signs are an immediate phone call. None of these are conditions to research at home. They are conversations to have with a clinician this week. I want you to imagine for one moment what it would mean to walk through the next 10 years of your life knowing what your heart is doing and why. To wake at 4 a.m. and recognize the cortisol surge for what it is instead of fearing it. To eat dinner at a sensible hour because you understand what your heart goes through overnight. To take an early walk and know that the morning transition is one of the kindest things you can do for your circulation. To stop blaming chest pressure on the spaghetti and start treating your body as a system that is, more often than not, telling you exactly what it needs. Almost none of what I've shared with you tonight is dramatic. None of it requires a procedure. It requires you to listen to a system that has been speaking to you politely for years. Here is the summary of what we covered today. Heart attacks in seniors cluster heavily between 4 and 6 in the morning, driven by a natural surge of cortisol, blood pressure, heart rate, and platelet stickiness during the body's transition out of sleep. The body very often warns you 24 to 72 hours before the event, with 7 specific signals. Unusual fatigue that does not match your activity. subtle shortness of breath with normally easy tasks, new indigestion that does not respond to antacids, pain or discomfort radiating into the jaw, neck, left arm, back, or between the shoulder blades, broken sleep with a vague sense of dread, cold sweats without an obvious cause, nausea or sudden dizziness. 3 or more of these in the last week deserves a phone call to your doctor tomorrow morning. Any combination of severe symptoms right now deserves a 911 call. The bedtime protocol of lighter, earlier dinners, modest hydration, careful medication timing with your doctor's input, a slow morning transition, and a monthly walking self-check is among the most effective heart protective routines available to you, and it costs you nothing. Before you close this video, I want to ask you 2 things, and please take 10 seconds to answer both in the comments. How old are you? The pattern of cardiac warning signs shifts measurably between the 60 seconds, the 70 seconds, and the 80 seconds, and the age of this audience genuinely shapes which topic I research for the next video. And second, have you ever woken up between 3 and 5 in the morning with a strange, uneasy feeling in your chest or your jaw that you could not explain? Drop the time you woke up in the comments. The pattern that emerges in those answers shapes the next video. And if there is someone in your life who wakes up at that exact hour, or who has been brushing off fatigue, indigestion, or jaw discomfort for the last week, please send them this video. They may have never heard the conversation that connects all of those dots into a single picture. Your heart has been speaking to you in this same language your entire life. Tonight, you finally know what it has been saying. I will see you in the next one.